Okay.
Okay, everyone ready?
Yes, sir.
Okay, good afternoon, everyone. Welcome to this meeting of the Board of Directors of the Nassau Healthcare Corporation. I'm Richard Kessel, the chairman of the Healthcare Corporation. I think what we'll do is just take a roll call, make sure we have a quorum, and then we'll go to the business at hand. So start to my left, Dean.
Dean Mahos is present.
Amy Flores, present.
Lisa Newland, present.
Richard Kessel, present.
Lisa Warren, present.
Okay, so we have a quorum, so we'll continue with the meeting. Our first item on the agenda is approval of our minutes. Now, I wasn't here at the time, but the last meeting of this board was February 18th. So I'll, first of all, hear a motion to accept the minutes. And second, is there a motion to accept? Dean, is there a second?
Second.
All right, Lisa, second. Are there any changes to the minutes or additions or omissions or corrections? All right, seeing none, all those in favor indicate by saying aye. Aye. Any opposed? Any abstentions? Okay, the motion, can you hear me? Yes. Okay, so I don't need this microphone. I'm glad to be here today. I just want to spend a few minutes talking to you a little bit about myself and some of the things at the NHCC. First of all, thank you all for coming today. My name is Richard Kessel. I was appointed by Governor Hochul to be the chairman of this board, and I'm very honored by it. I want to thank the governor publicly. I've obviously thanked her personally and privately as well for appointing me and for having the confidence in me, because this is a big task, but it's going to be a team effort to get things done. And I think that that's critically important. And I want to start off, before I say anything else, by thanking all the employees over here at the hospital. You know, first of all, the fact that the board hasn't met in a number of months, you know, it's because we didn't really have a chairman. And we wanted to wait and probably had to wait until we had a chairman. And so it's been a while. But I want to assure you that this board, and I want to tell the board members this, that we are going to meet on a regular basis from now on. We will have a schedule of meetings in September for the rest of the year. And I think that's important so that people know that when we're meeting, why we're meeting, and we do this on a regular basis. I think that's critically important. But I want to particularly thank all the employees, both medical, CSCA, love you. You guys have done a tremendous job over here. And I know, having been involved a little bit from the beginning, from my role as chairman of the Nassau Interim Finance Authority, NIFA, you know, a lot of the issues that have come up here. And I know that it's sometimes very difficult to work under that atmosphere. But you brought it forward. And I want to thank you all very much. I've got to start off by saying I really owe a lot of gratitude, and I think we all do, to Stu Rabinowitz. Stu's a longtime friend. I've known Stu for decades. And the job that he did over here, along with this board, and I want to thank each and every board member for the work that you did as a team, working with Stu. He did a spectacular job. He was the right person to be chairman at the right time. And I want to thank him for all of his hard work, his dedication. I actually spoke to him this morning. He gave me some good advice, which is to be very short in my introduction. I may not listen to that, but no, he did a fabulous, fabulous job. And I can tell you, because I was there, I worked with the governor and her team and her secretary, Karen Keogh. I want to thank her for all of her efforts and the whole team that was put together in Albany to put the legislation together, which ultimately voted in the change of governance here and the change in administration and management. I think they did a fabulous job. I was very involved in that, and I know how challenging and difficult that was. And Stu took this responsibility and ran with it and just did a fabulous, fabulous job. And I don't think I could ever fill his shoes, but he's a longtime friend and someone that I will continue to seek advice from as we go forward. And I think that we owe him a debt of gratitude for all he's done. Let's give him a hand. And I also want to thank the board members, both present and some from the past. Jason, you being the board member from the past. I think that you guys took on an awesome responsibility. By the way, I thought about this. It's a year anniversary since the new board took effect, and you guys have just done a terrific job. This hospital has changed so much in the last year. It's going in the right direction. You know, when they take polls, they always ask, is the country going in the right direction? Is the county going in the right direction? You know, if you ask, is the hospital going in the right direction? The answer is yes, it is. It's a whole new culture. It's going to take time. There are significant challenges ahead that we have to face, both financial, capital, and structural-wise. And a lot of the challenges, they're difficult, and it's going to be an uphill climb. But thanks to the leadership of this board, it's moving in the right direction. And I want to especially thank Tom Stokes, who is the president and CEO. I've known Tom for a long time. In fact, Tom, I met Tom when first he worked for Tom Swazi in the county. He was a deputy county executive. I didn't know that when I had left NYFA, because I was on NYFA twice. I was on the original NYFA board and ultimately became the acting chairman of the original NYFA board. Tom was on the NYFA board after I left. And he's just done a spectacular job over here. And I think that it's important to note that the job of the board and the CEO are a little bit different. You know, the board sets policy, and we kind of set, you know, the model of where the hospital needs to go. And then the policy has to be carried out by Tom and his team. I recognize that. I think the board recognizes that as well. As we go forward, I think that's going to be critically important. I want to say a few other things. Number one, this is one of the most important institutions in the entire state. It's a safety net hospital. It's open, and it serves thousands of people all the time. Tom is going to go over some of the numbers today. But I think it's important because, you know, when I was at NYFA, I heard all the rumors. The governor's taking it over, so she's going to close it. We're going to close it. This hospital must stay open. We've got a mission, and the mission is to be open to all who need us, whether they're uninsured, underinsured, minority, or anything else. We have to be their welcome mat to good health, and that's critically important. And I want to assure everyone from talking to the governor and her people and our own mission on the board, there is no intention to close this hospital. In fact, the intention is to make it better. You know, I read the press all the time about the hospital, and all these surveys come out, and we're like last. Sometimes we don't even make it. That's got to change. We've got to change the direction and the culture of this hospital, and that's what our mission needs to be. So I want to assure everyone that we want to work cooperatively, whether you're a doctor or a nurse, whether you're a member of the CSEA, we welcome you. We want to work with you. We're all a team. And while I know, and I'm not going to hide from it, that this hospital has gone through some very difficult and challenging times, and, you know, those issues are going to be resolved by other people. our issue is to figure out how we can grow and advance ourselves and be a welcome mat to all those who seek our needs and attention. I think, it's also important to point out that, one of the things that we put in the legislation was for the hospital to do an analysis of what needs to be like in the future. What do you want to be when you grow up? And we have to look at everything. And I commend this board, every one of you, for hiring Huron. I know that when I first came to NIFA two and a half years ago, almost 3 years ago now, we had Alvarez and Marcel in as our consultants. They did a great job. But Huron is going to do a spectacular job. But they can't do it alone. They need input. They need input from this board. They need input from the administration. And they need input, most important, from you. You've got to tell us what you think the hospital needs to be. And what are the populations that we need to serve? What are the services that we need to provide? And to some extent, what do we do in the future in terms of not just the hospital? How about A. Holly Patterson? We can't leave them behind. We have to make some decisions about A. Holly Patterson. Should they continue to exist? Should they be moved over to the hospital? Should they stay on Jerusalem Avenue? A lot of questions that are open that we need to answer. We also need to look at the land around the hospital. And I think that's critically important. There's a lot of land here. There's a lot of open space in the hospital and outside the hospital and adjoining the hospital. What do we need to do with that? That could be a potential revenue enhancer for this hospital to make us better. But we need community input. And I want to say that, when we were putting this legislation together, I worked closely with Senator Bino, Sheila Bino, and Assemblywoman Mickey Solage, and Assemblyman Chuck Levine. We want to involve our legislators too and our elected officials. Steve Rhodes, who is a senator, we need his involvement as well. He's a good friend. I work with these people in a number of the jobs that I've held in the past, and I think that they can be very helpful to us. But we have a big obligation. By December 1st, we have to report. We have to report. Actually, ironically, we actually have to report to NIFA, which I just left to head the hospital board, about all of these things. And we want to solicit community input as much as we can. I think that's critically important as well. Finally, just a couple of things about myself. You'll read a lot of things, some good, some bad. I started out as a gadfly before the old Nassau County Board of Supervisors. Best time of my life. I hate to age myself, and by the way, I will age myself by saying I'm a Knicks season ticket holder for over 40 years, and hooray for the Knicks. We finally won after all these years. Now, I went to a number of the games. In fact, I'll tell you a funny story. I have 2 tickets in section 110, first row in section 110, and for one game, I was offered $25,000. I mean, I could have erased the whole debt of the medical center. But Tom said, no, you keep it. You can go to it. And my son would have killed me. My son just graduated from high school, Calhoun, where I went at Calhoun High School in Merrick. And yes, he would have killed me because he loves the Knicks. He's a big seat ticket holder.
You raised him right.
I did. And I hope now he can start paying for some of the tickets. I showed Tom, I hope you don't mind him socializing a little bit, but an old friend of mine sent me a copy of a ticket stub. I actually had my first year going to the playoffs was 1970, and I slept underneath the garden on the street at midnight to get tickets. There were about 1,000 people there. And I did. I got a strip of tickets. Then I bought season tickets. I was 2 rows from the top in section 406. And she just sent me a ticket stub from a playoff game in section 406, 2 rows from the top, $5.75. Go figure it today, right? But it was great that we lit the hospital up in orange and blue. They're a great team. I hope to go to the parade on Thursday, but it's a great celebration. So I was a gadfly. Then I went, I met Hugh Carey, who was a governor. He was a great guy. And I was appointed to the Board of Trustees at Nassau Community College. And I served on that board for 19 years. Great honor, great privilege. Then Mario Cuomo came in. I was very friendly with Governor Cuomo, the first Cuomo. And I was appointed head of the New York State Consumer Protection Board, which doesn't exist anymore. That was a board that was there to protect consumers and to fight for ratepayers in utility rate cases. And our big issue was closing Shore Up. Governor Cuomo wanted to do that. We worked very hard on it. And eventually, Long Island Power Authority was created in 1987. I was not the chairman. I was on the board. The first chairman was a guy named Bill Mack. And he did a great job. And Bill Mack arranged a deal to close Shoreham and then resigned on his own, and I took over as chairman of LIPA. I was chairman of LIPA. Wilco still existed. For those of you who don't know, it's called the Long Island Lighting Company. Still existed. And then Pataki beat Cuomo, and first thing he did was try to fire me, and he did. He actually had to change the whole LIPA statute to get rid of me, but eventually we became great friends, and I became chairman of LIPA, and we took over the Long Island Lighting Company. LIPA is today owns the electric system on Long Island. I was chairman and CEO for 9 years. It was a great time in my life. Helped a lot of people, worked with a lot of people. I then left. I became just the CEO, and then I left and went back to be the president and CEO of the New York Power Authority, which is one of the largest, if not the largest, municipal statewide utility in the country. We own hydroelectric plants upstate. We actually own some facilities here on Long Island. I served as president and CEO for 3 years. I then left because I had a child, Eli, named after Eli Manning, by the way. I'm also a big Giant fan. And I eventually was appointed by County Executive Laura Curran to be the chairman of the IDA, the Industrial Development Agency. I served in that capacity for her whole term and the first year of Bruce Blakeman's term. And I wound up, after going to the IDA, being appointed by Governor Hochul to chair NYFA for a few years, and now I'm here. I want to say one other thing, and then that's it. People read a lot of things, and one of the things I think that's critically important is we are called the Nassau University Medical Center because we're in Nassau County. And I think it's critical that we have a partnership with Nassau County. And it's a little frustrating. It's been since I've been at NYFA, and the hospital has been a big issue on our agenda, that the county has really not partnered with us in the way that it should. The state has stepped up. They've done a number of things. We need the county's help. We need their partnership. I need Bruce Blakeman and his team to work with us to make this a better place. This board actually is short 4 people, and it's the 4 people that the county executive and the presiding officer of the legislature haven't appointed. I don't really understand why, but we need their help. We need their financial help. Nassau County used to give payments every year to the hospital. That ceased under former county executive Ed Mangano. We need their help. We need a partnership. This isn't about politics. This is about serving the people of Nassau County. This is especially about serving the underserved, the minority population, the Latino population, the African American population, the immigrant population, who may not even have insurance. That's what this is all about. And we need to form a partnership. And I promise you that I will make an effort, and I will report back to you to try to get the county to work with us in a positive way to help all the residents of Nassau County. So I'm thrilled to be here, and I look forward to working with every one of you. Feel free, I'm a very open guy. You can call me anytime. I'd be glad to talk to you and work with you. Finally, I just want, yes, sir. What's that?
So I'm not going away the time. What's our number?
I can't hear you. 516-398-6005. 398 6005. And I know if someone threatens me, it was you. No, I'm only kidding you.
My name is Dr. De Oliveira. I'm a thoracic surgeon at the hospital. I will send you a text message. I do have a project that is of nationwide importance, and I would like to ask for your help.
Thank you. Thank you very much. I just also want to say, I see some of my NIFA staff people here, and I'm glad you're here tonight. I sat with them. We met at the hospital. NIFA, just so you know, NIFA does have a control period over the hospital. And so I've got to be careful, and because I just came from NIFA, but they've done a terrific job, and thank you to the staff for all the great work that you've done over at NIFA. Okay, we'll get back to the agenda now. We're going to go now. We're going to have a presentation from our President and CEO, Tom Stokes. Tom, sorry I took so long.
No.
I think it was necessary.
I appreciate it, Richie. Yeah, no, I a few takeaways here. So first of all, I don't know where we're going to put another 4 members. We're going to have to find a new venue if that's the case. 2, you just gave me nightmares about my parents yelling at me because I thought they owned Loco, keeping the lights on all the time. By the way, I'll never refuse money from anybody, so if you offer again, I'm there. And then definitely not giving out my phone number in meetings like this. So all good. But thank you, Richie. Well, yeah. So there's been a lot going on since the last board meeting. I, too, want to start by recognizing our former chair, Stu Rabinowitz, and his efforts through March of this year. His last day as the chair was March 15th, and, had really kicked us off in getting back on track here at the Nassau Healthcare Corporation. And I'm over the moon to welcome our new chair, Richie Kessel, who I don't have to tell you now is a lifelong, diehard Knicks fan. So, and I'm actually shocked at the quality of his voice, given all the games and just knowing that he's attended all these games. So, you've probably seen the FIFA World Cup. What is it? The throat lozenges commercial? Yeah. People coming in. Yeah. Anyway, so I also want to recognize our interim leaders who are not here today. So, Rivka Mintz, our CNO, Rich Miller, our CFO, and Dan Lindenberg, CLO. In particular, who really put their lives into the Nassau Healthcare Corporation over the last year. We anticipate approvals this evening to advance on their successors. And of course, I want to thank the CSEA leadership and all the employees of the Nassau Healthcare Corporation for their partnership and commitment to change for our collective well-being as we move forward. As I mentioned, it's been busy. We've met with every department multiple times. We've held multiple staff meetings and events to better understand our opportunities. I've met with numerous elected officials on both sides of the aisle, as well as community leaders, local area hospital leaders, leaders of other public benefit corporations throughout the state, CEOs, CFOs, COOs, and we've engaged with advocacy organizations like the Greater New York Hospital Association, Haney's, and the Nassau-Suffolk Hospital Council. As we go through this presentation, it's going to be a lot more speaking than you're going to see words. I have some data that I'm going to share that Huron was able to produce, but we're going to talk a little bit about identity, trust, and strategy. And first, when we talk about identity, I mentioned at one of my first meetings, I think it was the first board meeting, in fact, I feel like I'm having a bit of an identity crisis, right? So I was hired, it was advertised as the CEO for NUMIC. I have a newmic.edu email address, but yet we're the Nassau Healthcare Corporation, right? Which includes A. Holly Patterson, it includes foundations, and we have an insurance captive that's based in the Cayman Islands. And then, of course, we have the relationship with Harmony Health, and we have the name New Health that's been floated about. So that all still remains confusing in my mind, and I'm sure it does to the public, and that's something that we're going to have to address as we go forward. But what I really want to focus on is, first, The identity crisis that I'm sort of, grappling with today as we're getting ready to pull together a strategic plan. First, around greatness, and with regard to that, these are the three areas that I think of when I think of greatness in this organization. I realize that we have distinctive pockets of greatness in trauma, burn, and psychiatry. And all of these areas can go head to head with any local area hospital, regardless of whether or not it's a public safety net hospital. And when I think about other areas that certainly don't fall within the category of greatness, and I'm not going to get into detail here, but there are areas where we need help. And frankly, you've seen some of the stories and have experienced, for instance, the shutdown in OB over the last 60 days. Not an easy decision by any means, but for the sake of our patients and the sake of quality, we felt the need to advance as we did. And I can tell you for sure, just to set the record straight, that had absolutely nothing to do with the finances of the situation. It was purely quality and some staffing issues that we needed to address. So we're going to be, continue to be transparent around these issues as we go forward. As we see issues that we need to address, they're going to be highlighted. We're going to deal with them in a similar fashion as we did OB, and I'm going to apologize in advance that we're not going to be able to share every specific detail in public. We do have HIPAA laws to adhere to. But, I hope there's an element of trust that's going to be developed to know that we're doing the right thing by our patients. And I will say, too, that, in these pockets of greatness, the other thing that we consider here, too, is that we are operating as a public safety net hospital. It's important that we recognize that that's the case and that we have these pockets of greatness within the organization. And one of the things that I just want to highlight before we get into further detail on this is that, there's this push and pull, and Richie really alluded to it just before when he talked about A. Holly Patterson. The fact of the matter is, as we get more and more data, as we go through this journey with partnering with Huron and all of you and the public and the elected officials and everybody in between, that NUMIC and A. Holly Patterson are a lot more codependent than we think. We think about the discharges and managing length of stay as we push patients to A. Holly Patterson. We think about the benefit, frankly, that A. Holly Patterson can provide to other providers, and we're going to work through marketing that and being much more public focused on that. We have Sparks data that you're going to see in some of the slides that I'm going to share, and actually the slide that's up right now has some Sparks data in it, which indicates that we have 79% of all discharges in Nassau County, all Nassau County hospitals, are for burn come through this place. 15% of all trauma discharges come through here. Now, that doesn't sound like a lot, but when you think about the varying levels of trauma, I can tell you that I was speaking with someone else from a level 1 trauma center this morning who happens to be a surgeon and flat out mentioned that, wow, the trauma that you see at NUMIC is nowhere near what I see, and this is one of the big ones that are out there. We'll get into more of the detail here. So I see Dr. Iowanu in the back there. This I've alluded to with him. So this is some of the Sparks data that we see. And this is how we're differentiated between some of these other larger hospitals. If you look at Northwell, NYU, Catholic Health, Mount Sinai, look at the level of acuity here. And you can see that in some of these categories where all the way down on the bottom, eating disorders, Northwell, NYU Langone, about not even midway up, probably a third up from the bottom, acute anxiety and delirium states. For the most part, Northwell, NYU as well, some Mount Sinai. But think about the population that we serve. The greatest percentages here, schizophrenia, bipolar disorders, major depressive disorders, off the charts compared to what others do. And frankly, I'm not sure that they'd be able to handle what we have going on here, especially given that we have a lockdown unit and they do not. This really sort of tells the story and brings us back to the dilemma that we have here, right? We have these pockets of greatness, but yet again, reminding ourselves that we are a public safety net hospital. Nassau Healthcare Corporation disproportionately serves the highest need patients with 10 times more Medicaid patients than any other individual hospital in Nassau County. The second highest Medicaid payer hospital in Nassau County serves 50% lower Medicare payer mix than the Nassau Healthcare Corporation. Some demographic information, as you can see here, NHCC serves 10 times higher share of population living below the poverty line, 64% lower household incomes than the population served by other hospitals, 15 times higher share of Black and Hispanic patients, and 30 times higher likelihood of an avoidable ED visit. Now, why is that? That's because of lack of insurance, deferred care, fear of coming to the hospital, and frankly, lack of access. So one of the things that I mentioned we're going to talk about is trust as we get through this presentation. We'll come back to that. Okay, so here we are. That was quick. So, by the way, some of the other things that I missed, just social needs, this really struck me as well, if you look all the way to the right. So 5 times higher childcare needs, 10 times higher food insecurity, 15 times higher housing instability, 10 times higher diabetes, obesity, and substance abuse, 15 times higher asthma. If that's not reason enough for the Nassau Healthcare Corporation to be around, let's talk about trust. So when I think about trust, I think about my personal experience, say 20 years ago when I was working in Nassau County. You know, Richie mentioned that I came in to work for then County Executive Swazi. I started with a financial turnaround plan. I was working with their finance team. I expected to be there for 6 months. In fact, I had another job lined up on the outside 6 months later. And I was asked to stick around. And as fate would have it, I ended up sticking around. And what I was asked to do was to create this thing that the politicians were calling no wrong door at the time. And through that process, without getting into what No Wrong Door was or what it was about, have some really fond memories of it, and I think we did great things. It's a matter of taking that to the next level. I'll get to that at the back end of the presentation. But during that period of time, what really struck me was that there was this element of trust, or really mistrust, out in the community, predominantly the Black community. And there was this distrust of anyone that had to do with health services or human services. And it emanated then from older folks in the Black community and the concern over medical testing that had been done decades before. So here we are today, 20 plus years later, and I was shocked to hear the word trust as a factor that came up again. So in all those individuals that I had met with, whether they're from here, out in the community-based organizations, the politicians, and elected officials /elected officials, I guess, the same theme came up, but totally different connotation now, right? It wasn't about medical testing. It was about access. And you told me to go to name one of the big providers, and I couldn't be seen, and pointed to me, Tom Stokes, Mr. North of middle-aged white guy with commercial insurance. You can get in pretty much anywhere you want to go within 7 days. If I'm not you, it can take 30, 60, 90 days to actually get an appointment. And that's fact. And as a matter of fact, we know that there have been lawsuits over people who have died waiting for their follow-up visits. It's taken so long. So that's where the element of trust comes in today. And let's just talk about why that is. Let's just have a plain, ugly conversation about the healthcare industry today. So big pharma is making money hand over fist. Hospitals and patients are receiving more and more pressure from insurance companies. We know that to be fact, even though they're generating billions in profits. And so what are the hospitals forced to do? They're forced to manage their schedules, or their panels, as they're called. So each and every doctor manages their ability to go ahead and schedule patients. And there's a scheduling template that's put together. And it ends up that what the reason why that becomes an issue is, even though these are New York State not-for-profit organizations, every hospital in New York State, and they're required to take patients regardless of their ability to pay, they limit those patients that don't have commercial insurance. And in fact, what happens is you have some practices that actually entirely eliminate Medicare, Medicaid, or self-pay or non-pay patients. And that's the dynamic that we're living in. So when I think about, this element of trust and what we're facing as a safety net hospital, we need to think about what our strategy is and how it is that we're going to be here to serve our patients. We've seen the recent press around the out-of-network status. I'm not going to name names, but with Fidelis and Health First in particular, these are low-income insurance plans. Others have the ability to say, hey, we're not doing business with them. We don't. We'll gladly accept those patients. And in fact, we're actively working to gain those patients. And we will continue to do that as we proceed. So let's think about strategy with all that said. First, we need to reestablish our baseline as a safety net provider. And right now, for us, this is a volume business. So at one point, our census, John and Perry, went down to the 230s. About 2-3 weeks ago, it's now north of Now it's about 320 as of this morning. We've had some ups and downs, to say the least. But again, I'll go back to this is a volume business. We're working to repair the relationship with Harmony. We have a referral interface that's been stood up. We have Health First in our lobby to meet with patients seeking insurance. And we have, we're challenging our physicians to think about the work effort allocation of our physicians seeing patients and to be as efficient as we can to increase throughput, to understand, frankly, what our capacity is. And we're challenging them to do that. And so second, when I think about focusing on affiliations, right? So first of all, let's establish the baseline and making sure that we're getting all the patients that we should be seeing as a safety net hospital. And I think there's more and more opportunities there, regardless of the Harmony relationship, regardless of the Health First and Fidelis issues. Let's go to affiliations. Many of you have heard me talk about this already, but we have special 2013 legislation that was passed specific to the Nassau Healthcare Corporation, where if we affiliate with another hospital, normally under antitrust laws, we cannot share our contracted rates. So Northwell cannot share contracted rates with New York Presbyterian, NYU, whatever. But under this 2013 legislation, we can. And we have our attorneys looking into the applicability of the federal laws as it relates to that state legislation that was passed. Looking promising, but we're getting a legal opinion on that, and we'll be able to proceed. They're really, aside from an immediate improvement in quality and an improvement in access, there are 3 reasons to move forward with affiliation. 1, those contracted rates I mentioned would bring tens of millions of dollars in additional revenue into our organization. 2, our electronic medical record today is about 35 years old when you look at the front end system, and we are about 7 months away from end of life. So we are going to have to band-aid, even if we had a solution today, we still need another year timeline to sort of bring us along. 3, I think of MSO, Management Services Organization. There are things that we do well, there are things that others do well, but think about infrastructure, legal, finance, accounting, whatever the case may be, that we can team with others to make sure that we are up on the latest policies, the latest laws, and make sure that we are operating top tier from a business perspective. So then we think about collaboration, high quality outcome driven care, and reconnecting with making sure that we're connecting both health services with human services, not just within our walls, but linking integrated case management and social work to the services provided by Nassau County, the community-based organizations, and everything that sort of leads to that no wrong door discussion that I mentioned, from 20 years ago. And let's think about what impact we can have on these pockets of poverty that exist in Nassau County amongst the richest zip codes in the world. And when you think about how services are typically provided by government, just blindly, think about the example, and I apologize because I know many of you have heard this already, but think about the example that I always give, which is, a victim of domestic violence goes into the Department of Social Services looking for food stamps because they need to eat. Well, the fact of the matter is there are many, many other issues that need to be resolved and addressed beyond the food stamps. So let's think about, I've got a child care, I need job training, I need shelter, and yes, I do need food stamps. So whether you're a taxpayer watchdog or you're out to sort of really provide help in case management and social work for the community, it all makes sense and it's a good thing to do. So all of that said, let me just end by saying that the strategic plan is underway. The PMO, the Project Management Office, I don't know if Vinny's here, probably not, is stood up to track internal and external efforts. We're partnering with Huron Consulting Group to produce a plan to be delivered to the governor's office via NIFA by December 1st. I'm not going to speak to the year-to-date financials because I'm sure board member Landsman is going to do that in his update, so I won't steal your thunder on that. But I will say we're not sitting on our hands, just waiting for things to happen. We're not accepting that we have a $167 million deficit budget. It's already better than that. We'll hear in executive session some of the initiatives that are already underway, well beyond what was included in the budget. And we're promoting ownership and accountability and advancing good business practices while ensuring the safety of our patients and employees. Thank you.
Thank you, Tom.
Richie, thank you.
It's great to see your appointment. Just so you know, Rory was, worked with me at NIFA as vice chairman, did a great job.
Thank you. It's nice to get the band back together, so to speak. And as you look in the audience and you see all the nice NIFA officials here, now you know that when they told you they were coming to meetings, they really were at the meetings. Tom, I don't know that one would describe the report on the Finance Committee as potentially being thunderous, but I will do my best to make it interesting. Good evening. The Finance Committee met on May 20th and heard from our interim CFO and his team. Through the first quarter of 2026, we are $81.6 million favorable to budget on operating revenue and $4.8 million favorable on expenses. This means that we're doing $81.6 million better on operating revenue and $4.8 million better on expenses than had been projected. Our underlying inpatient volume continues to be below projections, although the numbers seem to have stabilized. What put us ahead were two large unbudgeted payments that we expected, but we didn't know what the amounts would be, and therefore, acting responsibly, we didn't put them into the budget until we had them, but now we do. Those are $57.1 million from the state's Vital Access Provider Assurance Program and $27.5 million in IGT, Intergovernmental Transfer refunds. These dollars are very welcome, but they are not recurring revenue, and we cannot build our future on one-time money. Our job is to convert this cushion into a durable financial improvement. And there were four things that were discussed at the Finance Committee meeting. First, revenue cycle improvements, capturing more of the revenue that we've already earned by billing and collecting more effectively. Second, we're negotiating with our managed care plans to update contracts and improve payment rates so we're paid fairly for the care that we deliver. Third, we've developed a 2026 capital budget, which the committee is recommending for the board's approval, targeting the most pressing needs at NUMIC and A. Holly Patterson. This includes critical equipment, infrastructure, and renovations. And these are the investments that keep the volume coming through our doors. Fourth, we're strengthening accountability. The 2025 audit is underway, and we expect audited financial statements by the end of June. We're also recommending a clerical update to our procurement policy, aligning legal services, contracting with the outside counsel rates this board approved in December. In summary, we are ahead of budget. we're clear-eyed about why, and we are executing on the steps that will make these budget improvements permanent. Thank you.
Thank you, Lori. Are there any questions on the part of the board?
Good afternoon, everyone. First of all, congratulations to the Knicks. I was 17 the last time they took a title, so this felt really great. In terms of the Legal and Audit Committee, the focus has been on strengthening NUMEC's governance, compliance infrastructure, procurement oversight, and operational continuity. The committee met twice since our last board meeting on March 27th and also on May 20th. At March 27th meeting, the committee focused on foundational governance work, including discussion with the Office of the Medicaid Inspector General and the expectations for an effective compliance program, the advancement of a corporate compliance committee charter, and review of the proposed amendments to the procurement policy to clarify legal services procurement and billing guidelines, working with finance on that particular item. Also, at the March meeting, we had a substantial package of 34 contract approvals, which covered legal, technology, risk management, consulting, staffing, and operational agreements. At the May 20th meeting, the committee considered a series of compliance and policy items presented by our Chief Compliance Officer, James Saunders. You'll be hearing more from James and on those particular items later in the agenda, but they included the adoption of the LGS-1 as the baseline for the record retentions policy, an updated code of conduct, a corporate compliance program, and a non-intimidation and non-retaliation policy, all very important items. In terms of the code of conduct, it establishes the standards of behavior and compliance expected for all personnel in the workplace on NUMEC property while performing duties on behalf of NUMEC and when representing the organization. The corporate compliance program policy promotes adherence to applicable legal and regulatory requirements and ethical standards across NUMEC. It applies to all workforce members and, where applicable, contractors performing services within NUMEC's identified risk areas. Lastly, the non-intimidation and non-retaliation policies protects employees who report compliance concerns, suspected misconduct, and other inappropriate behavior, reinforcing NUMEC's commitment to transparency, accountability, and ethical conduct across the organization. The May meeting also included a large package of contract approvals, which included revenue cycle work, legal, medical staffing, equipment maintenance, electronic records, anesthesia, and academic affiliation agreements. So a great deal of work has been done in contract review, and in summary, you'll be hearing more of these, more detail around these items from Mr. Saunders. Thank you.
Thank you, Dean. Any questions or comments on the part of the board? All right. Seeing none, I'll now go to the final committee report, which is Medical and Professional Affairs Committee.
So I'm proud to serve as the chairperson of the Medical Professional Affairs Committee, and we also have Director Amy Flores and Director Jason Appelove who serve in this capacity. So we met on May 21st, and the members present, we did have a quorum. It was myself and Director Flores. We also had members of NUMEC senior leadership team there and others presented, which is a total of about 12. So our minutes from the February 18th, 2026 meeting were approved, and the big action that we took at that meeting was to approve the MPACT charter. So that was initially presented to us in December of 2025, and we needed to take some time to review it and make sure everything was in order, and it was approved at that meeting. And the purpose of the charter really speaks to the purpose of the committee, the scope and responsibilities, and we highlight the ideas of overseeing and recommending actions that ensure quality of clinical care, care, patient safety, performance improvement, and risk management efforts across the organization. We did have an executive session just for confidential matters as it relates to staffing and other things, but we were able to review and approve the credentialing packet that was dated May 15, 2026, and we'll take further action on that at this meeting later. But it was vetted by the Credentials Committee and the Medical Board for appointments and reappointments. And that was the summary of our meeting.
Okay, thank you, Lisa. Are there any questions or comments? Is there a second? Okay, second. All those in favor? Aye. Any opposed? Any abstentions? Okay. So, Roy, you want to take us through the resolutions that we voted on in executive session?
Sure. Okay. So the resolutions that were voted on in executive session first dealt with the settlement of several malpractice cases involving the corporation. Then there was a resolution regarding the management of the captive insurance entity in the Cayman Islands. And finally, there were a series of resolutions regarding the appointment of officers of the corporation, which are not being made public because of the need for officers to inform their current employers of their appointment. And that was the only thing that was voted on. Those were the only excuse me? In addition, there was an approval of a strategic health plan, health equity plan by the corporation. And with that, those were the only things that were voted in executive session. And if you want, I can then go through the resolutions, the remaining resolutions to be voted on by the public. Okay. So the next resolution here for the public session would be the approval of contracts. The board packet contains a list of contracts entered into by the corporation that need to be approved by the board. And the resolution, it's in your packet, says that whereas the Board of Directors of Nassau Healthcare Corporation, NHCC, or the corporation, must approve certain contracts entered into by the corporation for the procurement of hospital and professional services. Whereas the Board of Directors now deems it advisable and in the best interest of the corporation to approve the following contracts for the terms and amounts referenced in each resolution. Now therefore be it resolved that the NHCC Board of Directors authorizes the chairperson, president, CEO, or their designee to negotiate and execute the following contracts or amendments that were recommended by the Legal and Audit Committee at their meetings on March 27, 2026 and May 20, 2026, or are priority vendor contracts requiring approval of the corporation's Board of Directors. And the list of the contracts are listed. In addition to these contracts, the board packet also includes a list of contracts entered into by the corporation that do not require board approval, but we've provided notice to the board of the contracts entered into. So with that, Mr. Chairman, would you like to ask for a vote of the board?
Yes. First of all, do I have a motion to approve those contracts? Dean, is there a second? All right, Lisa, are there any comments from members of the board on any of these contracts? It's important to just disclose at this point that a number of these contracts may go before the Nassau Interim Finance Authority for approval. I've resigned from NIFA. I just want to put that on the record that I was chairman of NIFA. And I will vote on them, but I want to disclose that just for the record.
Okay, so.
Okay, all those in favor indicate by saying aye. Aye. Any opposed? Any abstentions? Okay, that carries.
Okay, next resolution is to approve the administrative modification to Section 2A of Procurement Policy LD-001. That resolution is long and is in your packet, but in summary, the LD-001 procurement policy governs NHCC's acquisition of goods, services, and public works, including limited exceptions to competitive procurement for legal services at board-approved Tier 1 or Tier 2 rates. The board is asked to approve an administrative amendment to Section 2A to align the policy with updated Tier 1 and Tier 2 rate schedules authorized in December 2025. The proposed revision clarifies that such services may continue to be procured without competitive processes when provided at approved rates and within budgetary limits. The amendment also updates outdated references and has been reviewed and recommended for approval by both the Legal and Audit Committee and the Finance Committee.
Okay, first of all, do I hear a motion? Amy? Is there a second? Okay, Jason, second. Any comments by any members or questions by any members of the board? Hearing none, all those in favor indicate by saying aye. Aye. Any opposed? Any abstentions? The resolution carries.
Okay, the next resolution is for approval of the revised record retention policy. Article 57, and again, it's a long resolution, which we will not read in its entirety. Article 57-A of the New York Arts and Cultural Affairs Law requires local governments, including NHCC, to follow records retention standards established by the state. Specifically, the retention and disposition schedule, known as LGS 1. NHCC must adopt a policy consistent with this schedule and applicable state and federal requirements. The proposed resolution authorizes management to immediately adopt LGS 1 and develop a comprehensive records retention policy for subsequent board approval.
Okay. Thank you very much, Roy. Do I hear a motion? Okay, Dean, seconded by Lisa. Are there any comments or questions by members of the board? Seeing none, all those in favor indicate by saying aye. Aye. Any opposed? Any abstentions? The resolution carries.
Next are a series of compliance policies. The first is a code of conduct. Again, that policy is set forth and is long. It's in the packet. In summary, though, the revised code of conduct establishes standards for ethical behavior and compliance applicable to all NHCC personnel and reflects requirements under the Public Authorities Law at Section 2824 1E. It reinforces the organization's commitment to integrity and accountability and has been reviewed and recommended for board approval by the Legal and Audit Committee. Okay.
Okay, do I hear a motion to adopt? Dean moves it. Is there a second? Jason seconds it. Are there any questions or comments by members of the board? Seeing none, all those in favor indicate by saying aye. Aye. Any opposed? Any abstentions? Okay, the resolution carries.
Okay, the next policy is a corporate compliance program policy. Again, the detailed policy is set forth in the packet. We will not read that in interest of brevity. In summary, though, the corporate compliance program establishes NHCC's framework for promoting adherence to legal, regulatory, and ethical standards as required under New York Social Services Law, Section 363D, and its implementing regulations. Recent updates, effective December 2022, require enhancements to compliance programs and expand applicability to certain contractors whose services relate to identified risk areas. The revised policy incorporates these changes and has been reviewed and recommended for board approval by the Legal and Audit Committee.
Okay, do I hear a motion to adopt? So moved by Lisa. Is there a second? Okay, Jason seconds. Are there any questions or comments by members of the board? Seeing none, all those in favor indicate by saying aye. Aye. Any opposed? Any abstentions? The resolution carries.
Okay, the final compliance policy is the non-intimidation and non-retaliation policy. Again, that's set forth in detail in the packet. We're not going to read it here, it's too long. But in summary, the non-intimidation and non-retaliation policy establishes protections for employees who report compliance concerns or misconduct and ensures compliance with Public Authorities Law, Section 2824 1E. It promotes a culture of transparency and accountability and has been reviewed and recommended for board approval by the Legal and Audit Committee.
Thank you, Roy. Do I hear a motion to adopt? Dean, I'll second it. Are there any comments or questions about this policy? I just want to make clear, and I said this to the board in our executive session, that I think this is very important. The culture at this institution was terrible, to be honest with you. There was a lot of intimidation. A lot of employees complained to me, and I wasn't even here at the time. I was at NYFA, and I'm glad that we have a board that is committed to openness and transparency and giving employees the right to protest when they feel that they were wrong and to not be intimidated. That's the worst circumstances that you can operate in if you're going to try to do your job the right way. So I fully support this resolution. All those in favor? Aye. Aye. Any opposed? Any abstentions?
Okay, the next thing is the credentials packet and approving credentials. You all have the credentials packet. The credentials packet was distributed prior to the meeting and included in meeting materials. This packet is recommended for approval by both the hospital's Credentials Committee and the Medical and Professional Affairs Committee of the Board at their recent meeting.
Okay, do I hear a motion? Okay, Dean and Lisa seconds it. Are there any questions or comments by the board?
Just noting that it's the credentialing packet of May 21st and June 9th, a recent meeting, so June 8th and June 9th.
Okay. All those in favor indicate by saying aye. Aye. Any opposed? Any abstentions? The resolution carries.
That is the last resolution, Mr. Chairman.
Are you sure?
I am sure.
Okay, before we entertain, I think, the motion to adjourn, just want to inform the public that the next meeting of this board will be on Monday, July 20th at 4 o'clock. We hope to see you there. And I thank you for those of you who stayed all these hours. I thank you. There's a lot of business that had to be carried on. The board hasn't met since February, and it's now June. So we haven't met for a long time. But we will now, as I said before, meet on a regular basis. Our next meeting will be July 20th, 4 o'clock. Do I hear a motion to adjourn? Lisa Warren. Lisa, the two Lisas, motion to adjourn, seconded. All those in favor? Aye. Any opposed? Meeting is over. By the way, here's a question I